So I'm going to talk about the 4 breastfeeding positions that you can do whenever you're breastfeeding and how to know that your baby is latched on correctly. So we're going to start with the 4 positions. The first position, which probably is the most common hold, is called the cradle hold. And so basically you're going to be cradling your baby in the crook of your arm, and your arm is going to be holding the baby like this, kind of like a side-lying view, and your hand can support the baby here, but it can also be maybe moving the breast like you need it to, things like that. So that is the cradle hold. The next thing is the cross cradle hold, which is very similar to what I'm doing here. But it looks like I just am moving my hand positions in different ways. So cross cradle, I'm going to use this opposite arm to support the baby's head and neck, support them here, but then I'm going to use this hand to maybe guide the breast into the baby's hand and help it that way. And when they're little, when they're really little and newborn like this is pretty important. So it kind of helps them find the breast, guide it to them, things like that. So that's the cross cradle. The next thing you can do is the football hold. So the football hold looks like the baby is tucked under your arm like this, and you are kind of like holding them up, protecting them. See how I'm holding the back of the baby's neck, and they are eating this way, and you can support your breast with the opposite hand. So that is the football hold. The last breastfeeding position is side lying. So imagine you are laying on your side, and the baby is laying next to you, and they are feeding this way. So they are laying down next to you, and they are breastfeeding that way. You could do it either side, where they are laying on the bed or the couch or something with you and feeding that way. Now, to determine if your baby is correctly latching, you need to pay attention to the mouth. The mouth should cover the entire areola. They should not be just sucking on the nipple. Their mouth should be open very wide, covering the entire areola, and their lips should be flanged out. So, if you look at this picture, it's the best way to describe it. The mouth is completely covering the areola, and the mouth or the lips are all flanged out and ready to go. If your baby, if you're breastfeeding and it is hurting or painful, or there's like this sharp pain, that probably means that they do not have a good latch, and you should maybe ask your postpartum doula for some support, or even talk to a lactation consultant. So there are all different positions that you can do. Also, if you need to break the latch, one of the things that you could do, you have to stop the suction from happening. So all you need to do is insert your finger into the corner of the baby's mouth, and that will stop the suction and be able to unlatch them.